Do you wake up every day fired up to make a difference? Are you committed to taking your nonprofit to the next level and beyond? I have news for you. Success isn't about hard work or passion. It's about having a smart, scalable strategy in place. Hi, I'm Tom Kelly, your nonprofit catalyst. You may know me as the CEO of Charity Our Stay and Donor Books or the author of The $1 Million Nonprofit. What I help nonprofits achieve that give them a significant edge and a clear path to substantial growth is the ability to strategically fundraise and effectively engage their community. And that's what I'm going to share with you right here on the $1 Million Nonprofit Podcast. In each episode, I'm going to take you behind the scenes to reveal the strategies, techniques, and tactics of successful nonprofits so that you can put these into practice immediately to grow your organization. No matter if we are talking about common pitfalls nonprofits make and how to avoid them, exploring how to accelerate your next fundraising campaign, looking at how to attract ideal donors, or everything in between, this conversation is designed to drive your nonprofit forward. Welcome. I'm glad you're here. Welcome to the show, Dr. Mona.
Thank you, and thank you for having me.
Yes. So can you tell us a little bit about your journey and what inspired you to start Music Beats Cancer?
Yeah, well, my journey started quite a while ago when I was a cancer researcher at the National Cancer Institute. And I think, when we think about cancer, fighting cancer, most people think about donating to research for the cure. Or they think about supporting hospitals and care. And so when I was a scientist at the National Cancer Institute, I realized that, in fact, as a scientist, sort of on the other side of the equation, we discover and we invent relentlessly. But we all knew these great discoveries and ideas that we were seeing in the lab would rarely make it to people and become something that could help people. We all understood that there was a very difficult path from discovery to clinic, and that to make this happen it was even so far outside of our own thinking, even at the time. And so I guess in those days, I understood that there was a disconnect going on between us working on cancer research and people who want to see change in the war on cancer. And in fact, at one point, we did have a discovery in our lab, and I did spin out a startup company to advance the discovery so we could maybe potentially develop it into a real solution. In this case, it was a DNA-based treatment for women who with ovarian cancer. And in that journey, moving from academia to a biotech entrepreneur is what we would call ourselves, I understood just how difficult it was. And really one of the biggest challenges was raising money. I guess no different from the nonprofit world. It was just raising money from ground zero on an idea that needed to prove principle. And in the end, we knocked on every door possible, but we couldn't raise the money we needed. And so that idea basically fell by the wayside. It fell into this, we call it the valley of death. It's this metaphorical place where great ideas go to die because they simply lack the requisite cash to move forward. And so Music Beats Cancer was born out of that journey to address this valley of death issue, because we understood the issue of running out of money was not just a problem for us in an industry or as a scientist, it's a problem for our public. There's more to it than just running out of money to develop an invention. Running out of money means a potential cure is stuck in this valley of death. On the one side, on the other side, there are patients that need new treatments and therapies and whatever it might be that just can't get access for the dumbest reasons. We just can't fuel and support its development. So that's where the genesis of Music Beats Cancer began. And the music part, everyone asks me, but where's the music? The music part is when I started to realize we actually need new rhetoric. So the rhetoric I said was, funding research for the cure, but we need to fund entrepreneurs for cures. That should be the rhetoric, because the entrepreneurs have solutions in hand, and they are the ones that are underfunded, unnoticed. And it was my, mission to put the spotlight on these bio entrepreneurs that I felt were at the forefront of fighting the war on cancer as well. And they were really in the trenches with solutions.
Where do you think, or what's like the biggest red tape when you do have a great discovery in the lab? And yeah, you need money to kind of get it out there, but is there anything other than funding that gets in the way and potentially like derails that or pushes you into the valley of death?
Yeah, I mean, yes, actually. I mean, that's a great question, because, in fact, this journey from taking science right out of off the bench, so to speak, and moving it to a patient, is full of challenges and regulatory hurdles, not just funding hurdles. Scientific setbacks. We thought it was going to work this way, then it works that way. Now we have 3 more studies, and those studies are going to cost 3 times the price, type of thing. And it's all this to de-risk it and to finally get this treatment, say, into humans, where we can really test its safety and we can really test whether or not it works. That journey, and that's what we call preclinical. The preclinical journey is hard enough in and of itself, let alone when you get into a human and suddenly everything you saw that was working in cells on a dish or in animal models suddenly doesn't work in humans. And then you're right back to square one, reassessing the science, or vice versa. Maybe it works, but it's just so toxic to the patient, and you got to go back to the drawing board. So there's truly a lot of risks. And I would say biotech is a seriously risky business. And the people that play in this space often need the know-how, and they need to understand the science, the commercialization path. So on the one hand, we're a group of folks that are seasoned in the industry, but on the other hand, we're a charity supporting these great ideas through charitable donations. So we play this interesting line between nonprofit and for-profit, but we know we need the nonprofit for a public matter and for public health. And that's where the two sort of collide.
And with Music Beats Cancer, do you fund multiple biotech companies, or do you find a small handful that you think have very promising technology and help fund them? How does that work? Can you walk me through that?
Yeah. So what's interesting is when I started Music Beats Cancer, it was the time when Uber had become a thing and Airbnb was a thing. We were championing these crowd models, right? So I thought, why can't funding great ideas be something similar, where we, unlike sort of the American Cancer Society or Susan G. Komen, we're not walking for life and doing fundraisers, and then the money goes to the organization, and then there's a committee, and then the committee decides, and yet the donor has no idea exactly what happened to their dollar and if it saved anyone's life, right? So I thought, what if we created Music Beats Cancer more like a crowd model, where anybody could donate to any great idea on our platform that they found compelling. And it was a true sort of intersection between those who wish to see change in a war on cancer with those working on solutions. And that's how we got. So basically, what we fund is that we don't fund, really. We pull all the companies together that we vet according to our criteria, and we put them on our platform, and then we market the platform, and we raise visibility, and people can decide where and how they wish to donate, where they think their dollar is going to be most impactful.
Do you have any success stories from a company that kind of has gone through your platform and was crowdfunded that actually brought their technology forward?
Yeah, so we have many interesting stories of successful raises, but more so for me is, and where I sit, and this is kind of something unexpected, is I would have companies come to me with some real far out ideas. And it's the risky, out of the box ideas that get me excited. And they don't get funded by the sort of the classical channels, right? And in some cases, they've raised money and it helped them advance, and they're still advancing. But one, for example, is we have somebody on our platform who's working on a sort of breathalyzer, if you will, for detecting breast cancer. So a woman would blow into this sort of tube and it collects the chemicals on your breast, and it then determines whether or not you're a candidate to go get a mammogram. And why that's important, and this is, again, another part of this really interesting journey, is there's so many ideas out there that you don't realize are really important. And this particular idea I learned is that the reason they even came up with this is because there's so many women who don't have access to getting a mammogram. And mammograms and the whole technology have existed for decades, but that doesn't mean women across the world have access to them. In fact, most don't. So they came up with this idea so that women could sort of go to a point of care doctor, and it takes one breath in 5 minutes, and now you have a screening mechanism. And it's really clear that women that do get screened are saved by, are often saved and because their cancer is detected early. Whereas in areas where women don't get screening, their mortality is much higher. And so we see these amazing ideas, and they don't take much sometimes, but it's so unfortunate that we, society, haven't been able to come together to support these ideas and really sort of flatten the health equity, field, if you will. Because what they say in the cancer world is your ability to survive cancer has more to do with your zip code than anything else.
Well, and I think it's amazing, the platform that you built, because you're exposing all these new ideas and potential technology to a group of people that it only takes a few that I guess can relate to it so much and can buy into it. And now they have a way of donating and trying to move this technology forward. And I can only imagine that the success stories that the company shares back to their donors is a big portion of kind of that first contribution, so that they can kind of keep them in the loop for kind of helping them propel their technology forward.
Yeah. But I think that's the idea of a crowd model, right? Is now the donor is giving directly to the doer, and the doer can respond, hey, donors, we just finished this study and it was an amazing result. We just want to keep you posted. Your dollars are really working for us, kind of thing. I mean, this is what I would like to see, is there's more connection. And quite honestly, where this really came to a head is during COVID. And first of all, we literally had a different public overnight, like a public that could say mRNA vaccine and could talk about getting their PCR test. Most people don't even know what a PCR is, right? It's the polymerase chain reaction. It's been around for decades. And it's one of those things. My entire dissertation is filled with PCR studies. But now the public is talking about it. Now the public can say mRNA. Now the public understands that there are companies like Moderna, and suddenly there is this interest in biomedical innovation and almost a new language around it that is in our public. But also, conversely, there was a lot of distrust of the public and with our institutions. And it's really because people like myself and others who are innovating have no forum to talk about what we do, the pace of science and the promise of science. The people don't know. They know when a man has gone to the moon, but they don't know when we've had some major breakthroughs in the cancer world where we're saving patients' lives or making their lives better.
Well, you hear about the stories, and I don't know if they're true or not, about the big companies taking a technology and if they don't want it, they buy it and just squash it. Is that a real thing that happens sometimes?
I believe that's a real thing. I believe it's a real thing because, after all, at some point, drugs become a business. And if you see a competitor out there, you're in trouble. You might want to squash that competition. Because your main drug is now being threatened, and so I do think that there's some truth to that, and that's like sort of the ugliness of drug development and the sort of the competition in our world. And my hope is that these companies that are working and developing on these ideas, if they don't see pharma making progress, that they have agreements in place and clauses in place that allow them to get that technology back. And that also happens where pharma says they're going to take it on, we're going to market it. And what's interesting in this sort of industry is the only groups that can take a drug, say, to the people is a big pharmaceutical company, because they're the only ones that have the deep dollars and the know-how and the marketing wherewithal to bring a treatment to the public. So, there's an interesting funnel that happens, in this world where you've got research producing, I don't know, tens of thousands of great ideas, to entrepreneurs moving them forward, and biotech advancing them to sort of a more, the tip of the funnel, where pharma just starts to pick which are the drugs and therapies that we should move forward to the people. And it's not always the therapies that are needed the most or that are life-saving. Sometimes they're the therapies that just fit better in their pipeline and their offering. So there is a cynical part of this, but I don't think that stops anybody from trying to do more and do better.
Yeah. Well, let's get back to the Music Beats Cancer organization. How big is your team, and tell me a little bit about your operating team over at Music Beats Cancer.
So our operating team is basically contracted folks, so like just the bookkeeper, the web folks, the social media, and that helps us keep quite lean, actually, and helps us have a lot of diverse skills. SEO, we can do ads, we can do all of the above as we need in a sort of a lean way. And then separately, our team, we're building and growing a team that's more sort of seasoned in the industry, that is helping us bring biotechs to the table. So they're seasoned at vetting what we bring on, and they're also people with networks that help us seek and court and go through the journey of accessing larger donations. And this is important because ultimately we want people care about our mission, who want to leave their legacy in fighting the war on cancer, to be behind us and to be loyal around our mission. So that's something we actually, as we speak, are currently building out, and in hopes to take us to this next level. I mean, we operate as a small mom and pop organization, if you will, like everybody does everything kind of thing. But we want to get to that next level of creating Music Beats Cancer as a sustainable business that can last until cancer is gone, type of thing. And hopefully we then are put out of business. That's my hope.
Right. With the contractors that you're assembling, do any of the contractors offer a discount, or even will do their work for free as a donation to the organization for maybe a tax write-off?
Yeah, so I would say our contractors are pretty reasonably priced, and that's kind of impressive to me. So so none of them have discounted per se, but then again, They're individuals that are pretty skilled, that are running lean groups themselves. I think the key here, the money is one piece of it, but the other piece is just that integrity. And I have had situations where contractors, they just don't have the integrity. And integrity should not be about how much money you pay somebody. It should be about, that's just the values around how people work. So I feel pretty strongly about that, because when you're a lean organization trying to make the world a better place, as a leader, there's no room to work with people that just don't have the integrity. Not just they need to be loyal, but they also need to have a certain integrity that they're going to do exactly what they say they're going to do. Nothing more, nothing less. And we're not, we're on the same page, and that they're going to do what it takes to help make us better and use their best skills. That's so meaningful to me. And not something, in this world where people ghost you and you think A is A and A turns out to be B. To find people like that is like, for me, it's like I found gold.
Yeah. Well, in this day and age now, I feel like it's very hard to find people like that. And you're right. Once you do find them, you got to hold on to them and, just kind of nurture that relationship as much as you can to kind of keep them in your world.
Yeah. Well, I just want to say that, in fact, there are people. There are lots of amazing, beautiful people out there that are just, that you got, you get excited that they're working with you. And it's two-way street, because they want to work equally. They want to work with someone who also has integrity and will treat them right. So I think the like-mindedness attracts each other, for sure. But really, it's, to me, there's something super insulting when you're working with somebody and they don't respect the fact that you're a charity working to better this world. And what you need is not only something affordable, but someone who's really capable and an honest worker.
Mm-hmm. So with some of the other nonprofits that are just starting out and listening, can you share some insights on forming strategic partnerships with like collaborations such as like family office networks?
Yeah. So, Music Beats Cancer has formed collaborations across the board, from the music industry all the way to sort of like you're saying, family offices and just groups that seem right. And it's actually not much different than I was mentioning with people you bring on your team. It's a very similar thing. I mean, you're looking for what they can bring to the table, but equally, what can you do for them? Whereas you have pains and challenges, but so do they. But I think what's key is that the missions, your respective missions, align. They may not be the same, but they align. And that's, again, as a leader, as somebody paving this path, that is what you're looking for. And vice versa. If they don't align, get out. It's not a partnership. Or, in many situations, as I go through my growing pains, I've aligned with wrong people and hired in, nor is it wrong, but aligned with people where I thought it was aligned, but it was misaligned. And then you find out at some point in time. And then the key is just to gracefully get out. And to not dwell on it either, but to understand the world is a big place. For every one loss, there's 10 more to entertain. And that mindset of abundance is super important as a leader.
Yeah, I agree with you about the mindset of abundance is a big thing. And so many people, are too short-sighted to that when they'll just take on anybody that's maybe just willing to give them any type of attention or money. And they might not be the best, donor, or maybe they're the neediest, or there's not the right person that you want to be associated with. And instead of just cutting ties and waiting for the next one to come around, because there will be one if you wait and you actually put in the work to try to search them out, you just have to be patient, know, and believe that something will come around the corner. I've had lots of clients in my businesses that we've had to fire because they would harass and make life miserable for my team. It's like, the money isn't worth it if it's if you're going home at night and you can't sleep because of the way that this one supervisor was speaking to you or talking to you or degraded you. Like, those aren't the people we want in our world. It's all about positive vibes and trying to keep the energy up.
Yeah. So so in that case, it's across all industries, right? You get people who are just, they're not the right fit. And all to say is, when I began, I completely entertained all those misaligned people, maybe for way too long, because you kept hoping, oh, this is going to work out, and this is the only person I know. And, and I would say, boy, those were painful times. It's not like that anymore. I've sort of figured out, if people, what's reasonable, what you're asking people to do, what's reasonable, what you're paying them to do, you live within reason, right? And when certain things are not delivered or done within reason, you got to find your exit. And that's just part of growing. And there's some patience in your own growth, right? You mess up, or you think something's okay and it messes up, and then you got to get out of it, but you got to get out of it also as gracefully as sort of you got into it, without denouncing and getting ugly and, just sort of cutting those ties and thanks for what you did, but now I'm moving on. It is definitely hard.
Yeah. And I think everybody has to go through those just to learn and grow from them. So what not to do down the road, or you just know the type of person you want to deal with and all the people you don't want to deal with. Right. So I definitely think it's part of just that the growing curve, I guess, of when you're starting, whether it's a for-profit business or a nonprofit business, it doesn't matter. You go through the same things. And you just, have to learn from it and always try to get better, and learn from and they're not even mistakes. It's just learning from every situation of what did you like, what did you not like about it, and then implementing, the changes on the next one. So I love that.
Well, you know what they say, greatness comes out of adversity. And so you want to be a great leader, you wish them adversity, because that's the only way they're going to figure out and confront themselves, So you're right. This is the school of hard knocks. It's worth every penny, type of thing.
Was there ever, I'm going to save this one question until the end, because I like asking it at the end, but who did you need to become to kind of go from a tech or a biotech entrepreneur to running a nonprofit? What were some of the biggest challenges you had to overcome, and who did you have to become to run a successful organization like you do now?
I had to become a mother. I know that sounds weird, but I really started, when I first started, I said I left, the National Cancer Institute, and then I spun out a company. And when I was doing that, I was pregnant twice and had little kids and breastfeeding, and then and I remember feeling so resentful that I couldn't do what I wanted to do professionally. I felt like I was climbing a mountain with my hands tied, type of thing. And over the years, I started to realize that some of my best skills were born out of the fact, just because I am a mother, and I have a certain patience and a certain, need to, because your business is your baby, and then the people around it are just part of that baby, and you want them to grow, and you need to be mother-like, which is keep pushing, but be as compassionate as possible. And, you're hard and loving at the same time. And it's such a hard mixture, but it's such a powerful mixture. because after all, what is a business but a bunch of relationships? And what is a mother but, trying to be skilled at leading, being that example, and being that voice, and standing for the things that you believe in, the things you want to see. And you may not see them now, but you still have to stand for them, if you know what I mean. Still have to hold the torch. I literally think I think about my colleagues. I think, oh God, these guys are like my teenagers. I tell them A and I do B. I do this and this that. It's like trying to get my kids to the dinner table. It's like literally the same feeling. But I've learned you don't get resentful. In fact, you get compassionate, right? In a way, and just like I would with my own children. Okay, what's up? What's stopping you from doing this or doing that? And so I liked, there's a lot of people have asked me about, being a women leader, and how hard has that been, and blah, blah, blah. And I like to think, and I still think, the mother is certainly one of the more powerful leaders there is. The one who has the mothering experience has something so unique and powerful. I don't feel like it's beneath others that have been grown up in a corporate setting, right?
Yeah. Has there ever been a time when you've wanted to just, as you were building Music Beats Cancer, that you've wanted to give up and throw in the towel?
Yeah. Hundreds of times. Yeah.
Yeah. Is there, I like that you said hundreds of times, because I love asking this question, because not one person I've ever talked to, and I've done hundreds of interviews with hundreds of nonprofits, the ones that tell me, oh no, I love it, are the ones that are like, I'm going to call you out on that one. I guarantee there's been times that you've wanted to throw in the towel, especially when you're first starting out, because it's just like, any business owner is the same thing. You go, and it's not an easy journey, and it's going to take time and effort. But I really would like to hear maybe one of your stories if you have it. But one of the things I think is everybody goes through this pain curve of we don't have enough funding, or I don't know what I'm doing, or I just don't have time to do this. But that, a lot of nonprofits, they give up and fail, and they close their nonprofit down 3 feet from gold. And it's like, if you would have just held in there a little bit longer, this organization could have been huge and thriving right now. And a lot of people, and why I love asking this question, is they think that they're the only ones going through this, right? They're the only ones that want to give up. They're the only ones, and maybe they feel that if they give up, they're going to fail, the people that they're trying to serve. But again, we were talking about earlier where these are just part of the pain curve, and you have to kind of go through them. And I think the most successful organizations or the founders are the ones that just say, nope, we're going for it. Yes, I had a bad day yesterday and I want to throw in the towel, but today's a new day, and, we're going to keep going after it. So, but I loved how you said hundreds of times.
Yeah. Well, Tom, yeah, maybe more. Yeah. So, but I think you have to put this a little bit in context, because when you start something, especially as I started Music Beats Cancer, and it was super radical. Like when I started, people wanted to shut me down right away. And I was not a person who had been so established in corporate America that I had my followers and my groupies and my people who were ready to write me checks and stuff like that. I didn't have a network. I didn't have a need. I had a doctorate, but in our world, that's nothing. Like in the world of science, like that's nothing, right? You have to then have build a reputation. And that I didn't have. And it's not only did I have it, but then I got myself out of the workforce because I was having children. And so, and in that world, and especially at that time, this is before even LinkedIn, right? I mean, when I started my own company, I remember pitching to investors at one point and being pregnant. I remember doing business plan competitions, and I was like out to here, gonna like give birth, anytime. And it's just so embarrassing, and everyone's looking at me because I look so deformed, and I'm shaking. And I guess I was thinking about when you start something that is so out of the box and you are starting from a place where people just don't know you, you're not at a pinnacle of sorts. The doubt around you is tremendous. And when you were asking me the first question about what kind of person you have to become, that is the first thing a person like me had to deal with, the doubt. Because what happens is when you get to these moments when you want to quit, you start listening to the doubt, the thick doubt that is around you and still is around me, right? Because what constitutes success is money. But of course, that's not really true. That's a bit true, but there's many things that would enable Music Beats Cancer to become a successful business and fulfill its mission. And sometimes we don't realize what we're up against, what it's going to take, the kinds of paradigm shifting we got to do, where we got to stand, who we got to bring on. And so when we are hit with these moments of pain, and you're already surrounded by a thick cloud of doubt, you're now not only down in your pain, but now you're in that between situation. Do I succumb to that doubt? Maybe it's just, I can't do this. Maybe I got to listen to all those voices that have clearly told me you're never going to make it. It's not going to work. Yeah, great idea, but it's not going to work. And so, and in those moments, I've had to double check myself. Well, maybe I should just get a job and work 9 to 5, maybe. So I have gone through that, I don't know how many times. And then I land back where I am for whatever reason, and so that is the gold in the journey, when you start double checking yourself. And then you land right back only to get back in the game. And that is how are you resilient? Are you at the same time, you don't want to be stupid either, because you could be. And it's really easy to, because you could think something's going to work but you're just so misinformed, or you're just not seasoned enough to understand that. And maybe you've taken a chunk too far, taken it too far, and you've lost too much. Can you really get back in your game? So you're constantly in your doubts, but one might say maybe that's the best place to be, because maybe that's just, you're always on your toes. You should never get comfortable, ever, otherwise it might impact your own leadership. There's always places to grow. So yeah, it's an interesting question that you asked, but it can't be divorced from the fact that when you do start something, there are forces around you that want to take you down anyway, not because there's bad. That's just the way the world is. You're going against the grain. So it's too easy to fall into going the other direction. So yeah, it's a very hard thing.
Yeah. What do you do to kind of keep building your leadership skills for the organization, for your team that you lead? What are some of those things that you do to help you kind of stay ahead of the game and learn new skills?
I use one word. I call it framework. Framework saves me, and enables growth, right? Because, and that's, I've done a lot of coaching and that kind of thing, and I have a personal framework, right? I have a rhythm in my week. I do this on this day. I do make dinner. We have a dinner table, and that's a family framework. I have a religion. I'm Jewish, and we observe the Sabbath, and that's a spiritual framework. That then kind of is in the home framework. That kind of makes me mentally sound kind of framework. Exercise it's to be able to create framework moves away from ad hoc. And in the times that I am at my worst, I can fall back on the framework and keep going. And that's why I do it. And now I mentioned I'm bringing on a team of sort of these seasoned individuals to help us capture the large dollars. I literally over this past weekend flew them all to one location to where I live. And we sat for 2 whole days, 8 hours each day, coming, being taught a framework. How do we talk to individuals? How does that first email go? How does that first meeting go? How's the follow-up be? And these are people that are not in philanthropy, but I knew inherently, if I don't have a framework for my team, we will be circling and never landing. And we will go through pain and and it'll stop us. So in my mind, the only way to deal with that pain of wanting to quit, to deal with the doubt and to keep going and growing is to institute sound and doable framework, across all things, basically. And nobody really thinks about it that way, but I've always thought about it this way. Even before I started Music Beats Cancer, I've always known this inherently.
Yeah. Well, I think what you said is you don't want to be ad hoc. You want to just, every day has kind of a purpose of what you want to accomplish. And you've kind of mapped it out and created that framework. Even with your team, like you said, I loved the fact that you brought them all together to put together or even build one, so that everybody's on the same page, because I think that's the biggest communication disconnect between teams is when you might know the framework, but nobody else on your team does, and you're expecting them to do it one way, and they've never been trained it that way, right?
Yeah. And they never been trained. They're not wired like that. But beyond that, and we also have a quote unquote coach. He tells us, he shuts us up. You're talking too much. You're this, you need someone like that to kind of hit you, not you, but you, the team. But again, someone who you're comfortable enough with. And he's not even in our biotech space. He's out of this. In fact, it's perfect. In fact, it makes more sense for us to be coached outside of our weeds, right? So we're not talking, we're always getting stuck in the weeds as individuals, because we come from different disciplines. So how do we harmonize? And yes, it moves us towards our goals, and it helps to keep us unstuck. Because to me, it's the two things, like you were saying, it's way too easy to give up. It's just way too easy. And if you are someone determined, and it's honestly no different than sports. Like I think about, they talk about Tiger Woods and all that. Like he's got a coach to perfect his swing. He's got a coach to help him with his working out. He probably has a coach for his diet, and he's got coaches of all kinds because he's got to be perfect. But it's no different than anybody else. He's just, it's just a different thing. But we all need this constant framework and coaching, and to try to capture it in some low cost way, right? So yeah, and there's a humility in there. Like we got to learn we're not know-it-alls. That's it,
Yeah, exactly. So how can people find out more about Music Beats Cancer? What's the best platform that they can learn more about? How can they get involved? What can they do to support you?
Yeah, so our website is musicbeatscancer.org. And if there's interest in learning about the campaigns, our cancer fighting campaigns, there's a sort of in the menu bar, a campaign button, and you can see all the great science that's going on. But also we'd love to hear from people who might want to volunteer. We work with and partner with artists, independent artists usually, or emerging artists. And we launched this event called the Music Beats Cancer Challenge, where artists get on our platform and they fundraise, and the one that raises the most gets something special. And we've been doing this with iHeartRadio, so inevitably we did this last year, and the artists who raised the most got to open at the Jingle Ball, which is a celebrity event. And so they got a lot of exposure. So we are often looking for fun ways to get the word out, to shift the paradigm around how we fight the war on cancer. And people that can be our real influencers. And usually the artists that do support us are ones that have been affected. And in fact, they teach me so much about cancer and the world of it. that I feel like I've grown from just out there talking to people who care, who want to see change, who've been affected directly or indirectly.
Well, this has been a great conversation. Dr. Mona, thank you so much for taking your time and sharing your wisdom with us today.
Thank you so much, Tom. Appreciate you having me.
Thank you for listening to this episode of the $1 Million Nonprofit Podcast. You're here. That means you're ready to take your nonprofit to the next level and make a greater impact. Come visit realtomkelly.com/playbooks to download free playbooks that your nonprofit can use today to start scaling to $1 million in donations. Plus, so much more. Catch the new behind-the-scenes insights on the next episode, and until then, here's to the impact you will make. I'm Tom Kelly. Don't forget to subscribe, share, and encourage others to listen.